Hi, my name's Eileen. I am an EB parent, and I wanted to share in this video, specifically today, a dressing that really helps with large wounds that also have a barrier that's been created by bacteria that needs to be removed in order for that wound to heal. So in the wound healing process, sometimes and often in EB, you'll see that there is something that looks kind of like a yellow mucousy layer on top of the healing wound. And we call that biofilm. And biofilm is an accumulation of bacteria. It doesn't necessarily mean there's an infection present, but it can lead to infection. And kind of more importantly, it impedes the wound healing process. And so we want that to be removed. It's painful and kind of difficult to remove, manually. And so what I want to talk about today is a really awesome dressing. It's called Polymem. So Polymem is the name of the dressing. It comes in regular Polymem, and it also comes in our favorite, it is impregnated with silver. We know that silver has antibacterial properties, and we don't want to have children on antibiotics all the time so they don't grow resistant to them. And so we find that this is a super amazing and effective bandaging for the wounds that have biofilm. And the reason is that Polymem is impregnated with silver in this case, and also a surfactant. And a surfactant really helps take that gooey layer away. But there are some big things you want to remember when you're using this. So it's extremely effective. This is the Max version. It's a little thicker. And when you have a huge wound or one that is pretty gunky, you will want to try Max first. The most important things when you use this Polymem, silver or regular, is you want to remember that you have to change it every 8 to 12 hours, at the most 12 hours. And the reason for that is because, number one, it's pulling away that biofilm really effectively. And when we pull away that biofilm, your wound is building actually healthy cellular matrices to like new skin and new cells. And so if this is on too long, it will start pulling at that new good, those good cells that are coming in to heal, and it can cause bleeding. And in our experience, as I talk to my son, it's very painful. That also being said, I think, and I would say many would agree, that you would want to have a contact layer over the wound before putting on the the Polymem. And what I mean by that is there are contact layers, two that we use. One is Mepitel. Mepitel is silicone. It's a little like sturdier, maybe a little thicker, less bendy than some. For example, the other one we use is called Urgotul. Urgotul is wonderful, but it is very, very flexible and even has a smooth feel to it. And so what we do is we first look at the wound to see which one we might use. And I also like to ask my son, since he's old enough, to have an opinion about which he prefers. But he will tell you that having this base layer on the wound prior to putting on the Max makes all the difference in the world, because it also protects that new skin that's coming in from potentially being pulled off by the Polymem. The other reason you want to change this is that because it's so effective, it pulls really well away from that wound, but it becomes, soaky, it becomes saturated. And when you keep it on too long, if there's good skin around that wound, it's going to start to potentially break down that good skin around the wound. So you really don't want that. So I have this silly bear here because I'm using him as an example. But let's say you have a very, very large back wound, which is painful. Of course, pre-medication as you wish, for pain, for itching. Wound healing in general is very itchy. EB causes children to have a lot of itch, and there are medications you can talk to your doctor about for that, which I would recommend for sure. So if you have like his back here, if I were to put my layer on, and there are different sizes of this and you can cut it to the shape of the wound. I'm going to use this contact layer that I talked about. Sorry, you can't really see him. you want to first just place that on top, okay? Just like this. And then, set him down a minute. You want to put on your silver. Okay. Yeah, silver is so amazing. So what you'll do is you'll put it on. You can trim it how you want, but you can also just put it on depending on the size of the wound. Over it like this. Okay. I would say that the best thing to do at this point is to just secure it. And what we use for that is something called Spandage. You're going to want to have this in different sizes. It's really wonderful to hold bandages in place. I have one today that I cut, and it's size 8. Size 8 is a good size for torso for most children with EB. What I do is I will, if you see it like this, I will fold it in half, long way, and I will cut a V like that, and then I will do it a little bit like this. Okay, and it's like so. And I'm gonna try to put it on this guy, but it almost looks like a little tank top. And so it'll hold that bandage in place on his back or her back. And it's really stretchy and it's soft and it tends to be comfortable. And so this will be cute. Put it on. Their little arms go through the holes. I'll show you in a minute. So you roll it down like a tank top, and it fell off my little bear, but it'll kind of look like this. Ta-da! I know it's not perfect, but that's the thought. And it is like a little tank with their little arms and this cute little belly. So specifically, I just wanted to talk about that bandage. Can be used. Just be sure to know the indications for using it and to definitely change it out. Once you see that the biofilm is gone, you'll want to go back to your normal bandaging. Thanks.